Welcome. You're listening to Pediatric Insights, Advances and Innovations with Children's Health. I'm your host, Caitlin White. The Child Psychiatry Access Network is a new program that experts at Children's Health and UT Southwestern kicked off in 2020. Its goal is to expand care opportunities for the pediatric population facing mental, behavioral, and/or developmental disorders. The program allows primary care providers to access the behavioral health community and its experts through teleconferencing and telephonic consultations so that they can connect their patients directly to a specialist. Today, we're going to talk about how the CPAN program got started, the benefits of the program, and how providers can learn more. Joining us for this discussion today are Brittany Mumford, the Behavioral Healthcare Manager at Children's Health, and Dr. Mili Khandheria, the Medical Director at the CPAN and TCHAT programs at Children's Health, as well as an Assistant Professor in the Department of Psychiatry at UT Southwestern Medical Center. First, Brittany, can you explain what CPAN is in more detail?
The Texas legislature funded CPAN as a resource to help primary care providers address pediatric patients with mental health concerns. So CPAN includes access to child psychiatrists for a consultation, which is free. It's prompt. The providers will receive a call back within 30 minutes. Also, consultation on non-pharmacological interventions, such as evidence-based alternatives to medications, and care coordination for patients who need follow-up care, such as resources within the community, and those will also be emailed back to the provider within 24 hours.
Dr. Khandheria, can you share some pediatric behavioral health facts specific to Texas?
Yes. So there are actually 7 million kids in Texas, but there's actually only a little over 600 child psychiatrists. So there's only 9 child psychiatrists per 100K kids, which is actually an incredibly low amount compared to other states. And many counties in Texas have 0 child psychiatrists. In Dallas, we have several, being a metropolitan area, but many rural counties don't have any at all. Despite attempts at workforce expansion, the shortages are not anticipated to radically improve in the next decade. So some things to consider when thinking about the number of child psychiatrists needed is that 50% of all mental health conditions actually manifest before the age of 14. So it's really important to get early intervention. By young adulthood, 75% of mental health conditions have manifested. 1 in 4 children suffer from a mental health disorder, and 5 to 9% of children actually have a severe functional deficit. So these are all some things that were being considered when creating this program.
And Doctor, can you tell us more about how this program began and what did it take to bring this program to life?
So this actually came from the 86th legislature. During that, they leveraged health-related institutions to improve mental health care for children and adolescents, and they formed the Texas Child Mental Health Consortium. So through this consortium, CPAN was created, as well as the Texas Child Health Access through telemedicine, the TCHAT program, the Community Psychiatry Workforce Expansion, and then expanding child and adolescent psychiatry fellowships. So in turn, more child psychiatrists would be out in the workforce. The mission of this consortium was to advance mental health care quality and access for all Texas children and adolescents through inter-institutional collaboration, leveraging the expertise of the state's health-related institutions of higher education, local and state government agencies, and local and state mental health organizations. So the vision of this consortium was that all Texas children and adolescents will have the best mental health outcomes possible. Specifically, our hub is powered through a partnership between UT Southwestern and Children's Health.
I know this program offers access to online mental health screening tools. Can you explain those screening tools in a bit more depth?
Yes. So we will actually be providing the primary care physicians and NPs with access to Vanderbilt, which assesses for ADHD, PHQ-9, which assesses for depression, and Scared Questionnaire, which actually assesses for a variety of anxiety disorders. And by utilizing these tools, it will help aid them with diagnosis, and then they can track them over time to see if the patients show improvement with the aid of this program. So they'll see their initial score might be very high, and then talking to us, the kid starts receiving treatment, and then they can see at the next visit, has it improved, and over time, have they gone into remission?
So, Brittany, can you walk us through the steps that primary care providers and patients will go through in order to take advantage of this program?
Yeah, so a provider will call our 1-888-901-CPAN hotline number and will provide the zip code of their practice. They will be transferred to the health-related institution that covers their county based on that zip code. Every county in the state of Texas is covered by an educational institution, and the UT Southwestern Hub covers 9 counties, which include Dallas, Ellis, Kaufman, Rockwall, Hunt, Collin, Denton, Grayson, and Fannin. Once they are connected to their appropriate hub, a licensed behavioral health clinician will triage that call by completing an intake process and gathering information to determine whether or not a consultation is needed with a child psychiatrist or if the behavioral health clinician can assist the provider. So if it's determined that a consultation is needed with the child psychiatrist, the behavioral health clinician will let the child psychiatrist know, and the provider will be contacted within 30 minutes. If the provider needs resources for their patients, the behavioral health clinician will be able to get those resources to the provider within 24 hours.
And Brittany, what are the benefits of CPAN for both the primary care providers and their patients?
So CPAN empowers the provider to continue treating their patients and only refer out when necessary. It allows the provider to feel comfortable treating behavioral health concerns with educational guidance from a child psychiatrist, and the patient doesn't experience any delays in their treatment process. So essentially, CPAN is 3 services in one team: resource and referral assistance, behavioral planning for youth in the care of a PCP, and educational consultation in real time with a child and adolescent psychiatrist.
Wonderful. Brittany, is there anything else you'd like to add about CPAN that we haven't touched on?
Well, if providers are interested in having their clinic enrolled or need CPAN services, they can call 1-888-901-2726.
And Dr. Khandheria, anything else you'd like to share?
Yes, actually, UT Southwestern and Children's Health, in collaboration with the other hubs across the state, have a CPAN website in the works for providers to have access to CME opportunities, which everyone needs all the time, webinars, and more information regarding pediatric mental health. We also hope to provide in the future some on-site training and lectures at some of our local practices across our 9 counties.
Well, thank you so much for this show, just chock full of information, ladies, and thanks for taking the time to share it with us. And of course, thank you for listening to Pediatric Insights. You can always find more information at childrens.com/CPAN. That's childrens.com/CPAN. I'm your host, Caitlin White. Stay well.